राजेंद्र सर?
जी सर, एकदम क्लियर आवाज आ रही है, क्लियर आ रही है।
क्लियर ही आनी चाहिए।
You want me to share my screen of the presentation? I think you'll have to grant me permission.
Yes, ma'am.
Yeah.
Ma'am, I am making a co-host, ma'am.
Okay, fine. Thank you.
Ma'am, you have the rights to share the screen, ma'am. Please check.
Okay. Yeah, I'll do. Are you able to see the screen?
Yeah, ma'am. It is clearly visible.
And it's in full screen, right?
Yeah, ma'am.
Yeah. Okay. Thank you.
अजहर सर स्टार्ट करें हम?
सर 2 मिनट रुक जाइए।
आप गुड मॉर्निंग।
हेलो अनुराधा मैम।
Hello, good morning.
गुड मॉर्निंग मैम, हाउ आर यू?
Good morning. Yeah, fine.
Azhar sir, can we start with the introduction?
So a very good morning to all the students, all faculty members. So we all have gathered here for a session by Mrs. Anuradha Ahire.
Azhar sir, you are muted.
A very good morning to all the staff members and students. We all have joined today for a session by Mrs. Anuradha Ahire. Let me give a brief introduction. She is currently working as Senior Manager IPR at Inventia Healthcare Limited. She has over experience of more than 5 years in formulation development at Indigo Remedies and Inventia Healthcare. And she is a registered patent agent at Indian Patent Office. So she is going to present, and the title of her presentation is Industrial Orientation of the Pharmacy Education and Introduction to Patents. On behalf of Ram-Eesh institutions, I would like to welcome you, ma'am. And I welcome you for your presentation.
Thank you very much, Dr. Azhar. Should I start with my presentation?
Yes, ma'am, you can
Yes,
start.
sure, ma'am.
So basically, I think all of y'all are Really, you students must be thrilled that in some time, maybe in a few months or maybe in a year, you will be actually, yeah. You will be actually getting your title of graduate of pharmacy. So you must be thrilled, but at the same time, you must be having certain, jitters of what next. The slide shows it in a fun way of now you will be actually entering into the real world. So, and you may be probably jumping off the cliff, but the funny side apart, you don't really need to be worried about it because during your graduation course, in context with the second cartoon, you've been trained how to use the parachute, what position you should be doing while diving, and when should you pull the cord, and what other precautions you must take. So it shouldn't really bother you, and your apprehensions are uncalled for. Because remember, whoever is in the industry today, in the pharmaceutical industry, were once upon a time they were also graduates, postgraduates, and students just like you. It's only that they have started their journey much earlier than you, and you're starting it today. Plus, you have this additional advantage of you have so much of information. Information is freely available today. So many education options, courses, and you have a lot of facilities. Opportunities are much more than you maybe had a few years ago. So really, this should not bog you down. And many of you will be making a mark or contributing significantly to the pharmaceutical industry in the future. So, but before you actually venture into all that, you must know what a pharma industry actually, what is it about? What is the process of the pharmaceutical industry? So basically, pharmacy education is used in areas like, first of all, the pharmaceuticals, which deal with the chemical molecules, chemical substances. Then you have the nutraceuticals, which are basically food components of food or supplements derived from food that are used for the general well-being of people. Just control some symptoms, maybe mitigate some disorders. Nothing more than that. They're mostly food components. They're also called maybe functional foods or dietary supplements. And then you have the herbal industry. The herbals, where they are, basically plant products. They are usually contain a mixture of components, similar acting components, which can be used either just for well-being, or for treatment of diseases, or for control of symptoms, either way. And then you have the biotechnology aspect, where actually biological processes, molecular processes, and living organisms are used to prepare your final product. So these are the major areas where you can find your opportunity in. So when we talk about a pharmaceutical product, be it herbal or be it a pharmaceutical, nutraceutical, the thing that first comes to our mind is maybe a blister, a capsule in a blister, or a cream in a tube, or an injectable solution in an ampule. But this is just one part of the product, because there are many different things that go into making of the product. Like you have the active component is an essential part of any product, and that is one of the main pillars of the pharmaceutical product. Then you have the excipients. Like active components have to be mixed with certain excipients, and then they have to be processed in the right kind of equipment to actually, and then pack it in the right kind of packing, be it bottles or tubes or ampules, and then you actually get to the final pharmaceutical product. So each of these is an industry in itself, and you must remember that when you search for your the opportunities post graduation, you have to understand that each of these is equally important, and they are interdependent on each other. Although they are invisible components, they are not seen in the final package that reaches the consumer, but they are equally important, and they are interdependent, and they are big industries by itself. We call it the excipient industry is a big industry by itself. The packing industry, the industry that makes the packing and makes the equipment industry, which makes the machines that are required for conversion of the active to a form that is suitable to the consumer. So when we are saying that the pharmaceutical industry is growing, not only are the products in the market growing, but all these in all these aspects, all these components that go into the making of the product, they also are growing at the same rate or maybe even more. So whenever you look out for opportunities, do not restrict yourself to the finished dosage form manufacturers or finished dosage form companies. You must have an overall look at all the other components that also go into the making of the product. Then what are the main areas when you talk about a product? Now this product may be either an API. For an API industry, their final product is the API. For a finished dosage form industry, their final product is the product that reaches the consumer. For an excipient industry, their final product is the excipient. And for or equipment or manufacturer, machine manufacturer, their final product is the machine. So whatever be the product, they have always there is a cycle, there is a product cycle that is followed in each of these industries. First is the research and development, where you arrive at a particular product. What are the departments that are involved? First is the regulatory, which come in with the which is the required permissions, the test license or other kinds of licenses. Then they advise on what kind of what are the characteristics of the product that need to be developed, how they should be developed, what should be the shape and size, for example, in tablets. So all those regulations are given by the regulatory department, according to which the development department then starts working. They work on the product, they prepare prototypes, and just preparing prototypes is not enough. They have to be analyzed for whether they are behaving according whatever the desired characteristics are. They giving the desired characteristics. So it goes back and forth. If not, then it goes back into the product development. Again, development occurs, etc. And then they have the required, what is the desired packing, that has to be determined. Then after the entire product is packed, it is put maybe on other kinds of analysis like stability analysis, etc. So all these processes take place during the development to actually arrive at a prototype. Once a prototype is decided upon, then they go for studies, be toxicity or efficacy studies. In case of excipients, the toxicity studies have to be done. In case of APIs or finished dosage forms, efficacy studies have to be done, maybe bioequivalent studies or clinical trials. And once that is successful, of course, intellectual property is throughout the process it is being used. So I will touch upon it in more detail later on in my presentation. So once a working prototype is developed, then you actually put it into the production, where it is made it's prepared, it's manufactured on a larger scale. So the actual manufacturing of the product, again, the quality control, where analysis takes place at every stage of the manufacturing, before it is packed, after it is packed, etc. And every stage, quality is measured and quality is controlled. You have quality assurance, which ensures that all the systems are in place. Maybe the humidity levels, the GMP, everything is followed. And then it is finally the product is packed in a pack that actually reaches the consumer. But in between, it is the technology transfer department which actually acts as the liaison between the R&D and the production, because making a batch of maybe 10,000 tablets at the R&D level and making a batch of 1 lakh tablets at the manufacturing level may pose some challenges in the scale up, because the equipments are different. The scale of the scale of a material that is used is different. So because of all this, there may be challenges, and that is mitigated by the technology transfer department, which ensures that there's a smooth flow of technology from the R&D, and a successful product is made at the production. Then the final product has to reach the consumer, and so the sales is important. Here you have the business development department, where they are the ones who actually decide which product will go to which country, which strength will go which country, or which product has the growth potential, and what kinds of what kind of client should we partner with, what kind of distributor should we partner with, what are the terms of the agreement, should it be profit sharing or one-time payment, etc. So all these aspects are looked upon by the business development. Legal is equally involved in checking or in analyzing the agreements, the term sheets, the confidentiality agreements, etc., and the actual sales and distribution, who are actually for the promotion of the product in the market. They may be medical representatives or distribution channels. So because of them, they actually reach the market, the consumer, or the doctors. So there are companies nowadays. We are seeing a trend wherein each of these areas of the cycle is actually independently becomes an industry. Like there are certain companies which only do the research and development of the product. They, through market intelligence or through client queries, they decide upon a molecule they have to develop and a product they have to develop, and then they develop it, and then they just sell or technology transfer it to another company or another industry. So such industries are called contract development organizations, or CDOs. Then you have industries which only do the manufacturing. They are contract manufacturing organizations. They have no research facility. They just take in the composition and the process that is given by a third party or a third company. They're just manufacturing it at their site because they have all the permissions in place, all the approvals, country FDA approvals in place. Many companies may approach them, we just want it to be manufactured at your site and then sent it to that or exported to that particular country. So such companies are called contract manufacturing organizations. And there are some which do both the development and manufacturing. They're called contract development and manufacturing organizations. So they develop the product at the R&D, they produce it and maybe file it, prepare the dossiers, and then tie up with some other companies for the sales of the product. Then there are companies which only do the sales of the product. They may be distributors, they may be agents, and there are certain companies which do through and through, from the first stage to the last stage. They do the development, they do the manufacturing, they do the sale to the end consumer. They may even have, the API is manufactured at their end. The same API is put into the dosage form and manufactured at their end. And then it finally reaches the consumer through their own sales force. But there are other areas too, because of the increasing, complexity of all these areas. The increasing trend in the industry today is that each of these activities can be outsourced. For example, there are testing laboratories, many testing laboratories that are coming up, which can do chemical analysis, physical analysis, clinical analysis. There are, the companies may find that there may be certain tests which are, use very sophisticated instrumentation. And so they may actually outsource it and get it done through an outside laboratory. Then the clinical trials and the animal studies that happen, there are many clinical trial centers who actually take these up for the clients or the companies. They prepare their own protocols, they decide how many volunteers, they source the volunteers, they prepare the reports, they statistically evaluate it, etc. So this is an industry by itself. Then there is portfolio management, which where the company actually it's a part of the company which decides what's good for the company. Suppose a company is already in the anti-diabetic segment, has a couple of products which is doing well, so they propose that you must strengthen your basket of anti-diabetics by working on such and such molecules. So they decide generally what the company stands for and what kind of what basket of products they should have. You have project management, which ensures a smooth liaison between all the departments. It's like a one-point contact wherein all the the data flow occurs, the queries are managed, and the hurdles are mitigated. You have warehousing and inventory management. This is important, especially important case of pharma products, because pharma materials are a little different in the sense they have their own expiry dates, they have their own retest dates, they have their own storage conditions. Every material has a different storage condition, and the chances, because of the chance of contamination, etc. So all this becomes, especially for pharmaceuticals, it becomes very important in how to warehouse, what are the conditions of the warehouse, how to warehouse it, and the inventory, how to manage the inventory, what should come in, or like there are certain systems followed, like first in, first out, such kind, whatever systems have to be followed, all that is managed by the inventory management group. Then you have the IT applications. There are so many IT applications involved today. Like you have the SAP. The SAP ensures that from the entry of the raw material into the company to its exit as a final finished dosage form, the entire thing is mapped in the system. So you can track it at any time. You can track what was the what were the test results of that particular material. You can track where it is at that particular moment. So these IT applications, a lot of them are being used in the pharma industry today, basically to reduce the human error and human involvement and make it more and more automated. Then you have other databases like IT applications which the BD or the portfolio management use. They are like market intelligence, which pick up bits and pieces from all news articles or SEC filings, approvals, and they make a background of what the product is or what a particular company is working on, which is to evaluate competition. It becomes, or the evaluate what kind of products would have a good growth. It is important. Apart from that, there is serialization, aggregation of the final product, which gives the entire history of when a product leaves the plant and reaches its destination. Suppose it's exported, it will give the entire history of how the product was transported, where it was, what were the storage conditions during its transport, where was it stored, which warehouse, and which ship was it shipped into, which port did it dock into at the end. So all this history is obtained by a lot of IT applications. Then you have the supply chain, which is actually involved in the purchase of materials and ensure that there is no delay of any kind. You have business consulting. See, the regulations in each of the countries in the world are quite different from each other, and for an industry to actually cater to each of these or to understand these regulations becomes very, very difficult at times. So there are consultants, business consultants, which just act as a bridge or a liaison. They understand the regulations of a particular area, and then they help you to gather the required set of maybe documents, licenses, whatever needs to be to file a dossier at that end or in the country of interest. Then you have the costing department, which actually what is the cost that actually goes into the making of the product, apart from raw materials, packing, what is the equipment, how much of electricity was used, what was the manpower cost, what was the water consumption, etc. All that is put up, and this costing actually decides what the price of the final product is going to be. So that is one important department that is there. And then you have the legal department, which goes into, again, all the agreements and the term sheets, etc. So what are basically the skill requirements of all these departments? Now, for API development, as you know, you will have to have knowledge about, this is the basic knowledge that you will have to have, maybe medicinal chemistry, computer-aided drug technology, drug delivery, and biotechnology, organic, inorganic chemistry to understand the reactions. And you should also have to have a knowledge about pharmacology, of how the particular moiety or how the particular pharmacore is going to act in the body. Then you just preparing a synthetic compound is not sufficient. You have to prepare it in a form that can be easily used by the industry. Suppose it's a sticky material that comes out. You have to understand through physical pharmacy, pharmaceutics, on how to convert it into a form, maybe a free-flowing powder, which can be easily used by the industry. And then, of course, the instrumentation. So not only how to use the instrument, but also how to interpret the results. Then dosage form development, of course, pharmaceutics, physical chemistry, biopharmaceutics and kinetics, how it is going to act in the body, where it is going to act in the body, organic, inorganic chemistry for the stability, to understand what the stability and what reactions are going on. Excipient development, again, requires similar kind of skills. Then packaging development needs, information about, or your skills with relate to what are the kind of materials, what are the regulations in the different countries about the packing that is allowed there. Animal studies, again, you need to know, or clinical trials, you need to know anatomy, physiology, pharmacology, biochemistry, Statistics plays a very important role, so you have to be thorough in that area too. Analysis of quality control is, of course, instrumental analysis, how to interpret them, chemistry, microbiology, production. Apart from all that, they also need an engineering, knowledge about engineering, because there are huge machines that are involved, and in case of breakdowns, etc. So how do they manage that? Environmental sciences, which is important for the manufacturing plant. Quality assurance, again, the GMPs and the regulations in the particular country. Then the regulatory department, again, the regulations, BD sales, because they are client facing, they need to have good communication skills. They need to know the entire process, at least overall, of how the product is actually being made. And then data analysis, how do you analyze the types of market intelligence that you get? IT, computer applications, equipment, which requires engineering knowledge, and intellectual property, of course, language skills, and pharmaceutics. So once you've completed a graduation, it becomes important to supplement your skill set with various other areas wherever you wish to go into. So there are many courses that are present in pharmaceutical packaging, pharmaceutical regulatory affairs, marketing management, business administration. So it's important that you supplement your skills. Right now, you just know the basics of everything. So you need to supplement your skills with additional, whichever department you go into, or whichever area you wish to go into, you need to supplement. Like if you want to go into research, MPharm, will actually show you how to go about, conducting a research, and a PhD will tell you why you need to do it. And it's a mini industry in itself, in the sense you have to, from sourcing the materials to arriving at the final product, everything you need to do it by yourself. So all these you have to continuously keep learning and adding to your knowledge of and supplementing your skills with various courses, various learnings, various readings. Now coming to the actual the introduction to patents, which is my core area. Let's actually first go, before we go into patents, what are the types of intellectual property that is actually there today? One is the trademarks. The trademarks is that's the most visible, intellectual property, where a word or a phrase or a symbol, the logos of companies, brand names of products, everything can be trademarked, or it's a type of it has to be registered, and it's a trademark. In fact, some kinds of smell is also smell marks are also there, where smell can also be trademarked, and it is basically a mark that identifies a particular product, unique identification of a product, and it distinguishes it from other products. Then you have designs, which actually relate to the aesthetic features of any object. Maybe it's the shape, it's the configuration, color, in the composition of the lines. And it can be applied on the object either through 2D or 2-dimensionally or 3-dimensionally. So it is basically what appeals to the eye. It is non-functional in nature. There may or may not be any function, but even if there is a function, it cannot be under the designs, but it's just a visual appeal. Then you have copyrights, which deal with musical works, artistic works, authorship works, in the sense books, then cinematographic works. Then you have patents and utility models, which are similar to patents, but they have a shorter term, and they are much less, they don't need to have an advancement. The invention doesn't need to have as much advancement as a patent. Even small incremental advancements can become a utility model. And then you have trade secrets. Now, all these other intellectual property rights are public in nature, in the sense they're publicly available. You can see them, you can search for them. But trade secrets is the only one which is a secret. But even to become a trade secret, there are certain rules, in the sense the trade secret should be very important or very essential. The thing that you keep a secret should be very essential for your product, maybe in your process or in your product, and you should take the steps to keep it a secret. In the sense, you have to sign confidentiality agreements with and keep it in close group of people, not circulate the entire, if it's a trade secret, you cannot circulate it to the entire industry. So this is one part of intellectual property right. Now, history of intellectual property rights actually goes back, way back in history, like even in 500 BC, chefs in Sybaris, they had, they were given a monopoly for a unique dish they had created. So they could, 1 year, they could just prepare the, their unique dish, and they would get all the profits. In 1331, John Kemp, he got a monopoly to, enter with his men and, teach his trade with respect to woolen clothes. Then in 1416, the first patent was awarded to Sir Francis Petrie of Rhodes, and it was with respect to a device for transforming wool into felt. In 1421, Filippo Brunelleschi was granted a patent for a ship or a barge which was used to transport marble across the river. So the history of intellectual property goes way back. Now we come to what is a patent. A patent is a grant of an exclusive property right, or it's a legal monopoly sort of, to an inventor or an assignee by a government body. And the purposes of the right is to exclude others from making, using, offering for sale, selling, or importing the invention. And it is given for a limited period of time. But you must understand that patent is not a positive right, but a negative right. What do I mean by negative right is that it will only give you the right to prevent others from making, using, or selling your invention. It does not give you the total right to make your invention. Now I'll just give you an example. Suppose you have a house, you have built a bungalow, you've paid all the home loans, and now the entire ownership of the house is yours. So you may or may not stay in the house. That is your choice. You may put it out to rent, or you may allow it to remain empty for a long period of time. Nobody is going to question you because it is your property. You can do whatever you want with it. But if somebody you enters your house illegally, then you go and file a police complaint. So you have all the right to prevent somebody from entering into your house or trespassing the area, or trespassing into your territory. So similarly, in case of patents too, it is not required that if you get a patent, you have to use the process, or you have to use the product, you have to put it in the market, but you can use that patent to prevent others from copying you. But at the same time, like if you go back to the example of the house, you have built a bungalow, but what if you have built a bungalow on a land which is owned by somebody else? So you're again violating the right of that particular person. Suppose you have used bricks and cement, you have just stolen the cement and the bricks without paying for it. So then you are again violating the right of somebody else. So it is not a positive right. Just because you have a patent does not make you, does not give you all the right to prepare or to use the process or to prepare the product. Like suppose you have a patent for maybe a method of extraction of a herbal plant. So what if the final product that you get after extraction is like, if it has a mixture of X, Y, and Z, and that composition with X, Y, and Z has already been patented. So even though you have a process of arriving at that, you will still be, once you're processing it and arriving at that final product, you will be infringing the third party's patent, which is already on the composition. Similarly, if you're using an intermediate or a solvent, say, in the extraction process, which is already patented by somebody. So again, you're violating his right because he already has a patent on the intermediate. Suppose you're using it through an equipment, but that equipment is already patented by somebody. So again, without his permission, when you're using your equipment to use a process that you have patented, again becomes a violation of somebody else's right. So There may be earlier patents for other inventions that an inventor may need to license. So if you actually want to prepare, a product, then you, in this case of, extraction from a herbal plant, you will have to take the license of both of the equipment manufacturer, of the final composition who holds a patent to that, and the intermediate. Only then you will be able to use your patent right. So this is an important part of what the patent cell actually does. I'll explain it to you much more in detail later on. And when you violate these acts, it is called, in terms of patent, it's called infringement. So you're infringing somebody else's rights. There are many, infringement. What is the action that is taken against infringement? You can go to court. You can make an, out of court settlement can be done, or you have to drag him to a person who's infringing. You have to drag him to court. Again, the court proceedings are where you have to, put your arguments, and the other party or the defendant will put in his arguments. So it's a typical lawsuit. Now, how long does the patent protection last? In most countries, it lasts for about 20 years from the date of application, although because the law differs in different countries. For some countries, it may be 10 years from the date of grant, or 15 years from the date of grant. But that is subject to payment of annual fees. If the annual fees are not paid for a patent, then it is free to use, and it has lapsed because of non-payment of fees. You're free to use whatever information is available in the patent. In certain cases, this may be increased to beyond 20 years. Like certain countries like the US and China, they have, provisions like patent term adjustments. Basically, when a patent is filed, it goes through the entire examination process at the country's patent office. And then if the examiner feels it is worth a grant, it is granted as a patent. But in the process, if there are any delays in the patent office, then that is taken care of, in the sense that the patent holder or the applicant is compensated for the delays from the side of the patent office by giving extra days in the term, which is called patent term adjustments. Then there are patent term extensions or supplementary protection certificates. They're also called so in countries like Europe. Here, this is very specific to pharmaceutical products, because the entire process of bringing a new molecule, be it biotechnological or be it a chemical molecule into the market, takes lot of years, lot of time, and lot of money, billions and millions of dollars or rupees. So the patent office has many of the countries, they have a linkage between the regulations or the filing of the dossier and the patent aspect. And if they find that, usually what happens is when you come upon a new molecule, you immediately file a patent, and maybe it's granted in the next 2 to 3 years. But the process for getting an approval at the regulatory body, at the FDA, takes much longer than that, because you have to conduct all your trials, and then it goes into examination at the Food and Drug Administration. That takes about 2 to 3 years. So you have lost on a lot of time after the grant of patent and before the grant of approval of the product in that particular country. You've lost a lot of time, and so to compensate for that time, and because it's a new molecule which is coming into the world, so certain countries do give patent term extensions, which can be up to 5 years. They compensate for the amount lost for the approval of the product in that particular country. So what are the benefits of a patent? First thing, for the patent owner, of course, it's beneficial because he has the total monopoly. He can prevent a lot of others from exploiting their invention. They can, whatever, for 20 years, if he gets the entire term, for 20 years, he's the person who is in the market. Nobody else can copy him. He can employ to raise funds for their business. He can license his patent to other parties. He can sell the patented invention, because patent is, after all, a property. So anything that you can do with a property, you can also do with a patent, like sell a patent, license a patent, lease a patent. So these are ways in which the patent owner can, monetize his patent. The second is what is the, for the general public, what is the benefit? Because patents are public disclosures. You know, if you see the patent document, it is a detailed disclosure of the invention, and where in such a way that any lay person or any person skilled in the art can actually copy that and use it for his own, benefits. So public gets a disclosure of the invention, and they can further build upon that particular invention. Like, for example, Alza. Alza, 30 years ago, they developed the osmotic technology. They had hundreds of patents on different types. Maybe whether it was the elementary pump or the controlled porosity osmotic pump. So they had lots of patents. But now that all the patents have expired, and even during, the people have got because of the public disclosure, people have understood how to build upon that, how to put in new molecules, how to use the technology. And so today we see that the technology is rampant in all kinds of molecules. They have been used just because Alza disclosed it in a patent publication or in their patent publications. Another way is, suppose there's a patent for a product X in the market, and you want to develop a similar product and put it in the market. And because there is a patent, you have to work around the patent. And you don't want to wait for the 20 years to put your product, because the growth is good. You want to put it in the market right now. So what do? You work around the patent. You find out ways of, not ways by which you will not infringe the patent. So that also leads to a lot of incentives and lots of, innovation, and assures that the quality of life is continuously enhanced. One thing you have to understand is that patent rights are territorial. What do we mean by that is, a patent is granted only for a particular country or region where it has been filed and it has been granted. So a patent application as such does not have any rights in the country. Only when it is granted, it will have rights, and only in that particular country. So suppose I have a patent today in India for maybe a topical composition, but the same patent, I file it only in India. And so there may be somebody in the Philippines who will actually prepare we will just take my patent document, prepare it according to it, and put it in the market. And you do not have any right to challenge him, because you have a patent in India. So, and there is no patent in Philippines. So he has all the right to, use your patent document to develop a product of his own. So the right that you have of excluding people from, or preventing people from using, selling, importing your invention is only restricted to the country or region where you have the patent filed and granted. So whenever you say that you have a patent for product X, you also have to say in which country. I have a patent number so-and-so for this particular in the country India, say. So that is always related to the region. You have to understand there is nothing called a global patent. Although there are, there are ways in which you can apply for an international patent. There is a body called the Patent Cooperation Treaty, PCT, we call it. Through that, you can apply in one single application. It is deemed to be applied in 153 countries. But when it comes to examination, each and every country will examine it according to its own laws and its own regulations. And so there is nothing like and there may be certain countries which will grant you a patent for the same invention. There may be some countries which will find it non-patentable according to their laws and rules and will reject it. So there is nothing called a global patent. It is always country-wise according to the laws and rules of that country or region. These are basically because patent is a techno-legal document. It is technical in nature, but it is governed by the legal aspect of patent laws, patent rules, patent guidelines, which is specific to and may be different in each and every region of the world. They are basically governed by international treaties like TRIPS and Paris Convention, PCT, etc., which these treaties give a broad guideline of this is how the laws should be, but each and every country can tweak it and can tailor it based on its need to foster and promote industrial development. before we go into what can be patented, we should also understand what cannot be patented. Now, patent right cannot be used in a way that will be harmful to humanity. So there are certain things that cannot be patented, like anything that is against public order, against morality, or against prejudice to life, health, and environment, like human cloning. That cannot be patented because that in a way is a prejudice to, or it's against the public order. Then scientific principles, abstract theories, discovery of living, non-living substances cannot be patented. Method of agriculture, horticulture cannot be patented. Medicinal treatments, whether it be medicinal, surgical, curative, diagnostic, they cannot be patented. Plants, animal seeds, business methods, computer programs, topography of integrated circuits, traditional knowledge, all this cannot be patented. Although this, again, what can be patented and cannot varies with country to country. This is basically what India follows. But there are certain countries like US, China, Canada, which allow, computer programs, softwares to be patented, or circuits to be patented. But in India, unless it is, attached to a computer hardware, such sort of software programs are not, cannot be patented. So now coming to what can be patented. How will you get a patent, and what are the criteria by which you can get a patent? First and foremost, it can be any product or process that has novelty or is new. In the sense, it should not be disclosed as such. All components of your invention should not be disclosed as such in a single document, or should not have been used earlier in anywhere. All the components. So that is novelty, or it has to be new and novel. Secondly, it should have an inventive step, or it should be non-obvious. In the sense that if you and you package it and sell it and try to patent it as an invention, there is nothing, because you have to it's obvious that the fruit will remain a fruit, the nut will remain a nut, and so there is nothing inventive that you're just mixing the two and giving it as a product. But if you process the fruit, hello, if you actually maybe take the fruit pulp and you powder the nut and you mix it together, put excipients like, suppose all-purpose flour, and you heat it up a little and put some sugar syrup and maybe convert it into a burfi, then that is a product which is very different from the fruit and nut that you initially had. It will have a different flavor, it will have a different texture. So that maybe is non-obvious or has an inventive step, and that is patentable. And the third or lastly, it has to be industrially applicable. Useless inventions can never be patented, like the cartoon shows it's a phoneless cord. You just cut off a cord from the phone and show it's an invention. It doesn't have any utility unless you show some other utility to it. So it has to be useful, it has to have some kind of industrial applicability. You have to understand that breakthrough inventions are not the only ones who get patented. Even incremental improvements can also be patented. They are suppose you have a patent where a stabilizer is used to stabilize a particular injectable solution. So if you determine, or if you find out a process or a composition where the stabilizer is not required, so this is kind of an improvement. You are decreasing the number of processing steps, or you're decreasing the number of excipients that are used in the particular composition. So this will be considered as an improvement or an incremental advantage over the earlier patents or earlier prior art. And so such increments and improvements can also be patented, because every patent is not a breakthrough invention. Most of them are like incremental or in nature. So what are the parts of the patent? So this is the first page of a US patent that was recently granted to my company. if you actually zoom in, you will find that it's a United States patent. So if you see, this is the patent number, and the date of the patent is the date it was issued or granted. That is, it was granted on June 1st, 2021. The applicant is the name of the company. The inventors are the people who, or the scientists who actually worked on the composition or on the patent or on the invention. Usually, when you are associated with a company during your employment itself or during your joining letter, and the clauses involved in that, it's usually that the inventor assigns his invention or gives his invention. Whatever inventions are made in the company belongs to the company. It's that way. So these are the inventors. The assignee, again, the name of the company. Then you have the application. When the application was first filed, it got this particular number. It was filed through the PC2 route, that is the international application route. So see, these are the details. Then here you have the abstract, which just gives in short what the invention is all about. Then the other parts include, field of the invention. What does it relate to? This particular invention relates to solid oral pharmaceutical compositions. Then you have the background of the invention, which tells you, you have to give details of what was done before your invention. What were the patents available, and what did they teach? What is the literature available, and what did they teach? Or if there are products in the market, what kind of products are they? So you have to put it into the background of the invention. Then the object of your invention, where you have to say how different you are from the background, or how different you are from the prior published patents, applications, or literature. Then you have to give a detailed description of the entire invention. Everything, all details, including what kind of excipients can be, because this is a solid oral composition patent. You have to give what all excipients have to be used, what percentages, what tests were carried out, what are the results. Like you have to even give some working prototypes. Like this table shows you the entire composition and how it was prepared. So all the details have to be put into the patent, which will enable anybody reading it to actually prepare it at their end. And then you have the claims. The claims is the actual scope which decides the scope of the patent. So when you evaluate any product with respect to a patent, you always evaluate in terms of this section, that is the claims. So suppose you read claim 1, you see that it's a pharmaceutical tablet composition comprising amorphous dapagliflozin having so and so particle size, 1 or more surfactants, and the ratio of the drug to the surfactant, where the tablet is an immediate release tablet. So whoever's the product in the market, or a third party, if it has a product which has all these features in its product, then they will be violating our rights, or the rights of the person who holds the patent. So what does a patent cell in the pharma industry actually do? So the first thing is, as I said earlier, that the patent is a negative right. So it does not give you the entire right to manufacture a product. So although we may or may not have a patent on a product or a process, but we have to ensure that the products and the processes that are followed for a particular product do not violate or infringe any other third party patents. So for this, we have to conduct a patent search. We have to in the area. Suppose I want to market my product in country X, then I have to conduct a search for the patents and applications in country X, find out whether my product is falling in the scope of the claims or following the scope of the patent of any of these of the patents, which are the relevant patents. If I am actually infringing any of the patents, I have to come out of it. I have to advise the R&D department or the manufacturing department that you will have to tweak your formula, you have to change this in your formula, you have to change this in your process to come out of the patent, so that we do not violate anybody else's rights or anybody else's patents. So this is one aspect what a patent cell does in the industry. The second aspect is they file for their own patents. They file for the company's own products and processes, they file their patents. And if they obtain the patent, they have to maintain the patent. In the sense, they have to pay the maintenance fees. They have to complete all the other statutory requirements. Once you file a patent, it goes into examination. The process is the process. The followed is first you file the patent, then it goes into examination. There are examiners which are present at every patent office in every country. So they examine your patent. They will send you examination reports, which will they will explain why your invention should not be patentable because of so and so reasons. They usually cite the reasons of it's not novel, it is not inventive, it does not have any industrial utility. See, these are the grounds on which they may say that you cannot be granted a patent. Then you go back saying that you respond to their examination report saying or defending why you think that your invention is patentable, and you give all your reasons for that. And if this goes back and forth couple of times or many times, and if the examiner is convinced that with your arguments, then he will grant you a patent. Once the patent is granted, then you have to pay the maintenance fees to maintain the patent. So this is another aspect what a patent cell in the pharma industry does. And then there are the oppositions, litigations, regulatory submissions. Now, if you go into oppositions, if you already have a patent or going to be granted a patent, and somebody else feels or a third party feels that you should not be granted a patent on this, they can always file opposition at the patent office, and you will have to, the entire opposition procedure takes place. You have to again place your arguments before the opposition board on whether how you feel it is patentable and it is novel and inventive and has utility. In another case scenario, you may want to file opposition for third party patents that the third party shouldn't have got a patent in the first place. So these are oppositions. Litigations is when the infringement cases directly go to court. Somebody feels that your product in the market is infringing their patent, then they take you to court, they file a lawsuit against you. And the litigations then, it's a typical court case where you have to give a lot of documents, you have to be witnesses, you have to share all your documents with them and give your responses and your arguments. Then there are regulatory submissions. Some countries like US, they have a linkage between their regulatory body and the patents. So if there is a product or a new drug product, new drug application product in the market, they usually associate it or they list the patents that are associated with that product. And whenever you want to file a copy product or a generic product to that brand product, you have to say, or you have to give your opinion, which is called certification. You have to give your opinion on why you think your product is not infringing their patents, or why you think that their patents are not valid or they should not have been granted in the first place. So these are regulatory IP or patents are also involved in regulatory submissions to many countries like US, Europe, and China. So this is also one part of what the patent cell does in the industry. Apart from that, you have the portfolio. The patent cell also assists the BD and the portfolio team to zero on molecules which have a good potential. But portfolio looks at the growth potential, and we look at what are the kind of patents are they. Can you circumvent those patents easily, or how many patents are there? How much cost it is going to take if there is a litigation? So putting in all that data, finally a molecule or a product is decided that okay, this such and such product looks promising both from the growth perspective and the IP perspective, and so the research team starts working on it. Then you have the patent cell is also involved in contracts and agreements, because every contract and agreement also involves IP clauses, where the two parties decide what happens to the IP of that, whether they will mutually share it or whether it's going to be sold to the other party, or the one party is going to license the patents to the other party if they are associated with the product that is in question. So these contracts and agreements, checking them, giving the suggestions, that is also a part of the patent cell in the industry. Other avenues are nowadays, because it's becoming more and more sophisticated, and the organizations are becoming bigger. Many of these patent activities are outsourced. There are independent law firms who handle all these aspects. They can prepare search reports and give non-infringement opinions. They can file the patents for another company. They can handle the entire litigation or opposition. So there are law firms who actually do all this on behalf of the company. Then there are databases. Lots of databases are used in patent in the patent cell. This is one avenue where you can find an opportunity, because every country has its own laws, has its own patents system, and many of the countries even do not have it. It's not publicly available. You can't search for patents in those countries. So these databases or these softwares, they pull out data, they purchase data from the patent related data from the respective countries. They pull it up in a database, so it becomes easily searchable by the customer, like any industry. So it becomes easier for them to search for patent data in different countries. It's a one-point contact. Apart from these databases, there are databases who also collate what kind of lawsuits have been filed, patent lawsuits, IP lawsuits, what have been filed, which jurisdiction, what was the decision that was taken, what were the grounds of the decision that were taken, what were the parties involved, and did they reach a settlement. So all this data is also collated by many databases, which again becomes a part of the market intelligence for the company to decide which molecule to go to, or what is the further course of action in that particular product. Then you have patent management. With patent management refers to the entire gamut of patents that you have filed all across the world. It becomes very difficult to manage the patents, like what maintenance fees has to be paid for which patent in which country, what replies have to be, responses have to be given, what other statutory forms have to be filed at the various patent offices. So if you have a huge patent portfolio, it becomes difficult to manage it. So there are many patent management organizations you use on softwares which actually manage the entire system for you. Then you have patent translators, because patent, again, it's a technical language. So normal translators, they may not have that particular expertise. So people having technical expertise as well as the language expertise are preferred, because there are many countries we do not, their patents are not in English language, but in their native language, like say Japan, like Brazil is in Portuguese. So it becomes very difficult for other countries to ascertain or to determine what exactly is in the patent. So patent translators are employed independently, or they also form a part of these databases or patent management systems. Then there are patent agents. India specifically has this concept of patent agents, where they can act as a liaison between the inventor and the Indian Patent Office. So there's an exam that needs to be given. The exam is declared by the Indian Patent Office, I think once in 2 years. The duration of the exam varies. And once, even a normal graduate, even if you're actually in the final year of your graduation, you can appear for this patent agent exam. It relates to the patent law and patent rules that are followed in India. And once you get through the examination, there are written papers. So once you get through the examination, there is also a interview process. And if you get through that, you will be a registered patent agent. For graduates who are still doing their graduation, the only requirement is, once the result is declared, I think within 1 or 2 to 3 months, you have to submit your degree certificate to the patent office. So this is one area where you can look into. And so they basically, because normal inventors may not know the legalities of filing patents, the law involved, like which forms have to be filled, what signatures have to be taken, how should the patent document look like, what are the sections, what is the spacing, what are the timelines, when should the complete specification be filed. So all this, by studying the patent law and patent rules, one gets an idea of what needs to be done. And so they can act as the liaison, because the inventors may not know about the legality. So these patent agents who have both the technical and legal expertise, they will help them get the broadest coverage for their patents, and they can on behalf of the inventor, they can file the documents, they can appear before the patent office, the examination board, to present the arguments. So these are some of the the courses that are available. I am not endorsing any of these, but just a list of what is available today. I've done the postgraduate diploma in patents law from Nalsal Pro, and I am a patent agent, registered patent agent from the Indian Patent Office. But apart from that, these are the other courses that are available. If anybody wants to do more in this field, they can actually look into these aspects. For the patent office, a law degree is not required, but to fight infringement cases or patent cases or IP cases in the courts, you need a law degree. So if you are really serious about entering this, then a law degree also would be very beneficial to you. So listening to all this, my only advice to all of you is, like, don't stress out, because it doesn't mean today, the career that you should choose today, or the area that you choose today, it doesn't mean that you're going to follow that, or you're going to have to do the same thing for the next 30 years. You are going to get many more opportunities in the future, where you will actually be able to learn what you or to understand what you actually want to do, and you can always diverge yourself in that particular direction. So I think, as the cartoon says, you only need to know what you don't want to do. So the rest is like an open field. You can try it, you can enhance your skills, and if you find that you are particularly interested in one particular area, you can always jump to that particular area. And many companies internally also, they give that opportunity nowadays, that you can if you want to take a jump from one area to another, you are free to do so. So don't stress out on what you're going to do today, because over the years you will understand what you actually want to do. So, and you will get all the opportunity to actually, the only thing is you should have the right attitude, that you should learn. Your attitude should be to learn the maximum at whichever place you are, because no knowledge is a waste. Every bit of knowledge that you learn is used somewhere or other during your career. Every bit of all the subjects that I studied in my graduation has been used at one point or the other during my career. So don't worry that I've spent so much of time in this particular area, I don't want to waste that. No, everything comes to use. Everything is building up on your is a building block to your career. So it's like Barack Obama famously said, this is the time you have the awareness. So now it's you have the awareness, but now is the time for action. So opportunities are everywhere. So don't worry and don't stop learning. And you will have to keep enhancing your skill sets as you go by, and I think you'll be able to understand as you progress during the career what you actually want. So thank you for your attention. If anybody has any questions, they can.
Thank you so much, ma'am, for sharing such a valuable information about patents. Discuss so many areas in which we can work in the patents. It has already been asked to the student that you can post question in the chat box, but still, if any one of you want to ask question, you can unmute yourself and ask question. Okay, we have a question here. It's from Manish. New use of known substance or its new use in pharmaceutical composition, can it be patented or will it come under utility model?
No, actually, the patent, India is specifically, it has a section called Section 3D, which specifically prevents from such, evergreening of molecules, where they say that a new use or a new application or a new form of a known substance, unless it shows an enhanced efficacy, they will not be granted a patent. So utility model also will follow the similar kind, unless you show incremental, if you show an incremental increase or a surprising effect which has not been seen anywhere in the literature or in the prior art. If it's a known, it's obvious that this kind of molecule, if it acts on this, it is also going to act on this particular disease. So if it is obvious, then you will not get it. But specifically patents, the Section 3D will prevent you. Utility model, because the rules to obtain the inventive step, the provisions to analyze the inventive step is much less in utility model. You may have a chance, but then again you have to show some kind of difference. You have to show some kind of some surprising effect from what is already known in the art.
So any other question? Anybody want to ask question? He or she can unmute and ask question. Or you can type also in the chat box.
You can raise your hand and ask the question if you wish.
Yes, there's one more question. How to know if a product is patented or not?
There are many, free databases available. The Indian Patent Office has a site where you can actually search using keywords, using applicants, using various various parameters like application date or priority number, all the numbers or the dates or the keywords. So the Indian Patent Office has a site where you can search for the patents. Similarly, a lot of countries, maximum of the countries have their own sites or their own patent offices where it is easily available. So, and for countries which do not, have this publicly available, there are certain, paid databases which give you that information. But for India, US, Europe, it is all publicly available. Like in case of US, if you go to uspto.com, there is a site which will tell you search for patents or search for patent applications. So you can easily search with your keywords, with your inventor names, with the applicant names and other parameters. Similarly, Indian Patent Office site, Indian Patent ipo.gov.in. If you go into that, you will get a list of the Indian Patent search portal is called INPASS, INPASS. So you can actually search for applications filed at that particular site.
There is one more question. R&D sectors have become more market driven rather than focusing on research. Don't you think patent impact access to affordable health?
No, I think in fact it is, yeah, it is the case in countries, in a sense. If you see countries like US, they are more, brand centric, where they always they favor the brands, and the brand companies definitely have an advantage there. Systems like I already said, patent term extensions, etc., add to that a view that they are more lean towards the brands. Although the things are changing now, more generic friendly laws are also being used. But in developing nations like India, I feel they've maintained this balance, because India, as I said, Section 3D, you can't patent polymorphs. You have an active moiety, you just can't go on patenting the polymorphs A, B, C for these active moieties unless you show an added efficacy. Whereas in US, it is possible. For a molecule, you have 10 number of patents, with the amorphous form, the crystalline form 1, 2, 3, 4, 5. So this, that is the beauty of the agreements like TRIPS agreements, where every country has been given the freedom to tailor their requirement or their law according to their abilities and according to their condition. So India has adopted this 3D section. In addition, it has adopted the compulsory licensing section, where the government can actually use a patent which has been which is from a brand company and can give affordable medicines to the general public. So it depends on country to country. In India, I think it's a good balance. It's not hampering the affordable medicines that are reaching the public. In fact, it is fostering more and more, innovation. How do you think so many generic manufacturers are sending their products to the US? Because they have realized their capability to work around the patents that are already there in the US and EP and in Europe, and they are able to successfully, export these to these countries. So in India per se, the laws and rules have been devised in such a way that there's a great balance between innovation, patent protection. There are laws that prevent anti-competitiveness of the patents, and plus it also encourages you to take up innovations and incremental improvements in their technologies. I hope I've answered your question.
There is one more question from the same person, Manish. Do you think there is a need of global patent or not?
No, again, as I said, the global patent, that is precisely what the opposite of the answer I gave you just now, because patent laws and rules, according to each country, it has been designed according to their own abilities and abilities and what are their capabilities. So I think I personally feel it should remain that way, because you cannot put the developed nation in the same bracket as a developing nation. In that case, then you can say that affordable medicines may be difficult to reach the general public, because suppose you have a global patent on a particular molecule, then that brand or the applicant who holds that particular API patent will have a monopoly on the entire world with a global patent, which is not what we desire right now, because there are so many developing nations who are still developing their laws, or they are trying to venture into, and they're trying to grow in the pharmaceutical industry field, and this will be a big hindrance to that. So I think the way it is now, where each country is able to take care of its own needs and necessities by tailoring their patent laws, is region specific or country specific patent is a much better option. Of course, when you think of a global patent, for a patentee or an applicant, it maybe becomes a very convenient way, where you just file in and you you get a patent all over the world. But I think economically and if you see the world countries of the world, I think this particular system that is being followed today, or that is a country-specific system, is definitely a much better system than a global patent system.
I suppose there are no more questions.
Yeah, I think there are no more questions. So I would like to thank you, Anuradha ma'am, for sparing your precious time for us. And as the lecture was very informative for the students, and we had involved few of other students also from first year to third year also through the YouTube channel. Actually, you have covered all the aspects from starting how a product gets developed and what are the departments involved, everything. And after that, you discussed regarding the patents, very, I can say, detailed manner, and you are the best person who could have done justice to this topic. So I think that students are benefited a lot today, and they may now be in a position, probably some of them may definitely choose this as one of their career opportunity. So I thank you very much, ma'am, for giving us your precious time, and I would just like to share the certificate of appreciation from our side to you. Thank you, ma'am, for this lecture.
Thank you so much.
Thank you, ma'am.
Thank you. Thank you so much for this opportunity that you have given me, and really wishing all the students all the best, and may you contribute a lot to the pharma field in your future endeavors. So thank you so much.